Uh, Good evening. My name is Jo Garangtush, one of the high research student at Torrey University. Tonight, I'm presenting the assessment pre-commercialization pitch entitled Health Equity Solution for South Sudanese Australian Immigrants Communities. One of the research units leading research, innovation, and commercialization. Uh, yes, I have assessment. One was more of the innovations double diamonds project. Assessment two was research leadership's development plan for the health equity of this community. This commercializations pitch is the third assessment that is a big project which combine assessment one, double diamonds, and the research leadership development to work out that solve the issues in the double diamond and in the leadership development. I'm going to present the solution for this one. And thank you for listening in. The solution to the problem is uh, health disparity costs Australian 1.2 billion annually in preventable hospitalization. 42% of those are South Sudanese immigrants face chronic disease such as hypertension and, and diabetes. 68% reported health discrimination, which is fragmented intervention fail to address the intersecting socio-cultural, environmental, and systemic determinant of health. So, which is one of the research that I'm championing, and that's the benefit to solve for these projects in commercialization page. I do have a solution, or we do have a solution that I have integrated cultural health platform. I call it the acronym that I call it is ICHP. Is going to champion the digital navigation hub where the bilingual health guide of policies and telehealth with community health ambassadors. Who are these ambassadors? Will be those who have two to three languages within the community, who are health expertise, nurses or medical scientists will be part of this digital hub. Food severity cooperative, those who are farming in the town, those in the region, producing cultural significant crops such as sagam. Sagam as a chronic, I mean, as organic benefits that will solve the issue of hypertension and diabetes. If these crops are available in the market produced locally, that will benefit the issue of chronic diseases, hypertension and diabetes and many others. Discriminatory reporting dashboard is going to display real-time data for healthcare accreditation reform to reform the entire healthcare if they reduce hospital readmission by 37% in a pilot studies. Um, Now, I do have a market opportunity for this project. Total addressable market will cost 28 million dollars year by 2028. That's my target. Segment Department of Health and the site or revenue potential. 4.1 billion year will be part of that within the Department of Health. 12 million contract will be provided as the revenue potential. Refugee settlement is going to be sizes into 40,000, and others users will also benefit to subscribe the model for this one. Cooperatives partnership such as the ASEX at $100 million or diversity targeting 78% of this one will be part of that. And the I do commercialize the strategy in three phases. Intellectual protection, going to solve the issue of diagnostic algorithm with the PCT or slash AU 2025 slot uh, slash triple 0123 trademarks cultural navigation system. Um, the uh, the the revenue stream going to display government licensing fees model for settlement agencies, data analytic for hospital accreditation. Phase 3, the scaling module, which is going to franchise the cooperative to 5 cities, such as Melbourne, Brisbane, Perth, and Canberra, and Sydney, and many other cities will also be part of these three phases. I have implementation policies, implementation team in two categories. The core leadership team, where I'm going to be the chief executive for this project, uh, has the health professional expertise in public health, plus the community trust will be part of the core leadership. Tech director would be who has specialized in health digitals, will be part of the core leadership. Policy led, which has already been seconded by the Victorian Health Government Relationship, will be part of that core leadership. Advisory board will be selected across regionally and state and territories, who will be the South Sudanese elders or leaders, presentation 30% to equalize the presentation. Health economies from different universities. An example of those University of Victoria has those as specialized in health equities will help us to be part of the board to make sure this project has a proper equality implementation that is going to benefit and solve the issue of socio-cultural, environmental determinant, and systemic barriers determinant of health. Will be this expertise in health equity will help us um, to in the advisory board to make sure the implementation is thereby and is benefiting the issue of the risk mitigation, where I call it the IP sub-guide, as a threat for the community engagement protocol, uh, the risk and the strategy. Data security is one of the major risks. I'm going to make sure the HIPAA compliance encryption is going to be displayed. The blocks or the block shells audit will be part of these strategies to make sure the data security is solving issues. The user adaptation will make sure the core design with 200 plus and others community testers will be part of this, who are the users and will be adapted through that as a strategy. Policy chip, making sure that this contract will be bipartisan through the parliamentarian group, who will be helping to make sure this policy is passed by the parliaments. Those in the territories who are the MP in the territories, who are the senators in the territories, will be part of this and help us. This policy is changed within the Department of Health and also across the healthcare system. The competition will be 12 months with refugees, health navigators, be part of this. Um, Finance, how is this project, the financial projection? I request the funding will be 750,000, 450K product development, 200K pilot implementation, 200, 100K IP protection, return on investment, timeline. Year one, breakdown with pre-government contracts. Year three will be 2.1 million revenues, 35 margin. And and strategy provide the standardized for evaluating perform, making it compare different investment objective. And I have a vision, impactful vision for this project. I targeted that by 2030, 50% reduction in diabetes and hypertension as the chronic disparities, 20 policy reform within the health dashboard will be within the health dashboard data will be implemented. 200 jobs will be created in the community cooperative, which is a very huge change. 200 jobs will be created by this project, which is going to solve the issue of low income to those who could not acquire the quality medication or the eating healthy will be benefiting through this one because no one will be left without employment. I do conclude by saying health equity isn't cause, it is the smart investment. Let us invest smartly in this project. Let us not leave everyone. Let us be part of this project I have references here to recognize the journey where I have finishing this. Thank you so